Hello, everyone. I'm just going to make 3 brief points to help arm everyone here for what the next phase of our struggle is going to be. We know that the original Omicron wave in most states in the country is going down. And so we're going to hear a lot of nonsense telling us we can all go back to normal now, which we've heard before. So I want to begin by talking about the evolution of the virus, where that is going to go and what that's going to keep doing. The second point I want to talk about to just keep reiterating, policy is the #1 factor in determining how many people live and how many people die. And the third point is that policy can be changed, and we have control over this. We have the ability to do something about this. So I'm just going to share my screen real quick. So in yesterday's news, we got news from Denmark that the latest subvariant of Omicron, which has been called BA2, is 1.5 times more contagious than the original Omicron. This is this is one of the faster turnovers from one version of the virus to the next that we've seen. Part of the reason why we're seeing such quick evolution is because we have seen such rapid spread. The virus only evolves to become more transmissible. That's the only direction evolution moves in. And yet we're, in spite of the fact that, this new variant is in close to half of the states in the country now, everyone is going to be told, there's nothing to worry about, Omicron is over, and you can all go back to school. This is something we have heard over and over and over again. When in 2020, the original wave of COVID-19 that had come from Wuhan, China, when that wave started to go down, we were told we could all go back to normal and go back to school, and that left everyone completely vulnerable for the inevitable next wave of evolution, which was Alpha, that came around in the winter of 2020, and very quickly became dominant all over the world. After the Alpha wave peaked, going into the going into the early spring of 2021, the CDC in the United States took the outrageous policy of saying, well, not only is everything going away and everyone can go back to normal, but if you're vaccinated, you don't even need to wear a mask anymore, and everyone can, start preparing for school. That left everyone completely vulnerable for the Delta variant, which took over the United States that spring and summer, and as that peaked, everyone was told, well, now Delta's going away, everything's safe again. You can send your kids to school, and if you're vaccinated and tested, then feel free to have your big family vacations and holiday gatherings during this winter. And of course, during those holiday gatherings, people spread Omicron all over the country, and so now for the 4th time in a row, we are being told, oh, it's going away again. The Omicron wave has peaked, and right on cue, there's a new phase of evolution at hand. So this is this is a remarkable situation in which the virus is constantly adapting and constantly improving, but our public policymakers are not adapting and are not improving and are doing the same stupid thing over and over and over again. And so that is, that is making the virus look a lot smarter than our public policy officials. This is something that I believe there are high school students on this call, and if you took biology in high school, you know the basics of evolution, that especially for single-celled organisms, they evolve through mutations. The more they spread, the more they create mutations, and those are just kind of accidental, poor copies that they make, just accidental errors in copying the genetic code. When you get lots of those mutations, you have genetic diversity, and so you can have competition between those diverse mutations for which is better at reproducing, and whatever is best at reproducing is what becomes dominant, and that's how it keeps on changing. So the faster it spreads, the faster it replicates, the faster it will create mutations and the faster it will evolve. And this is, very basic, high school biology level evolutionary theory that that everyone can grasp. And the virus is never going to stop evolving. And so to be telling people that, oh, we can all go back to normal now and everything can go back to the way it was before the pandemic, that's kind of like saying, we can now make America great again. It's a fiction. It's pretending we can have some kind of utopia without solving the problems that are right in front of us. And we're going to have to be the people solving those problems. The other point that's worth making about the places that have already seen their Omicron surge and have had a decrease in their curve of infections. South Africa was the first place to have their big surge and get it over with. But once the curve went back down to a new low baseline, the new low baseline was 25 times higher than what the baseline was before Omicron. And the response has been somewhat different in different countries. In places like the United States, it looks like the new subvariant BA2 is spreading very quickly. And in other places, after the Omicron surge, they actually had a resurgence of the Delta variant. So this could end up being a kind of messy and confusing year in terms of the evolution of the virus. And we should not be, paying attention to the people who are just trying to advertise, everyone can go back to school and pretend that things are normal so that, businesses can be making money and consumers can be spending money. That's all that's going on here. Second point, policy is and remains the #1 factor in determining how many people live and how many people die. And you can see this just by comparing different countries all over the world. The United States has had some of the worst policies in the world, along with countries like India, countries like Russia, have done virtually nothing. Also the UK, virtually nothing to really stop the spread of the disease, and have had, just a, disastrous public health response. In the United States, 1 out of every 400 people have died out of the population as a whole. In the UK, it's almost that bad, 1 out of every 450. In particular, some of the hardest hit countries are very connected to the United States, just south of the US border. Countries like Mexico, Peru. In Peru, that country has lost 1 out of every 164 people in the country as a whole. Mexico has had a severe death toll. Mexico is one of the top 5 countries in terms of numbers of deaths. And this is no accident with Mexico and Peru. Those economies are connected to the US economy. But in other parts of the world, it doesn't look like the same pandemic, where in the United States, we will soon have a death total of 1 million. China is only beginning to reach 5,000. In China, approximately one out of every 311,000 people have died, which is a very different number than 1 out of 400. You might think that can't be the same disease. It is. It is the same disease. It's just different policies. And so and I'll talk a bit about which policies affect the rate of death the most profoundly. But I want to begin with the point that of all the different policies, nothing affects your chances of death more than the country in which you live. The vaccine will make you many, many times less likely to die. But the difference between living in the United States versus New Zealand or China or Australia or Iceland, that determines whether you're hundreds of times more or less likely to die, because that is an accumulation of many policies. Now, with all of these things, we certainly want to be talking about the policy that we're focused on here for this meeting, which is the basic policy of closing down a school, something that has been completely normal to do for an outbreak of almost any other serious disease. You have an outbreak of the measles, you close down a school. There are now multiple studies showing, okay, what is the practical effect on the pandemic for closing down schools? How effective is this? So I just brought up 4 studies. 2 of them come from the journal Nature, which is a very old, respected British science journal. Also BMC Medicine, I think that stands for Biomed Central, and the Journal of the American Medical Association. And these aren't the only studies that show this, but these are measuring what is the overall effect of having schools open versus having schools closed on the pandemic. This first study is kind of astounding because it's a comparison of countries all over the world, and 226 countries in total, ranking the effectiveness of many, many, many different measures, and found that the policy of closing down schools reduces the rate of transmission of COVID by 73%. And this was measured globally. We have another study here, Biomed Central Medicine, studying 130 countries and finding once again that school closure and internal movement restrictions are are some of the strongest measures, along with workplace closure, income support, and debt relief. That when you take these kinds of measures, you greatly reduce the severity of your COVID outbreak. Again, effective, specific, non-pharmaceutical intervention policies. Once again, finding that school closures are one of the best non-pharmaceutical interventions you can make to reduce the transmission of COVID-19. And another study we've referred to persistently, this one is limited just to the United States, but obviously all of these things are consistent with each other. Association between statewide school closure and COVID-19 incidence and mortality. This study found that when you have school closures, you reduce the number of cases by 62%, and you reduce the number of deaths by 58%. There are more studies showing the same thing, like a broken record. And okay, you have all of these studies in journals that, these are those kinds of journals where if you are a new scientist, getting your study published in one of these journals for the first time is like the biggest, accomplishment of your life. You're now a published scientist. So we have these kinds of studies pointing out the same thing over and over and over again. Why is this not what we're hearing about in the news? Why is it that the public health officials who we hear talking on television in the United States are telling us, oh, it's always safe to go back to school. School is the safest place for students to be. All this, very hard work by many, many scientists has gone into, proving the effect of this policy, and no one ever hears about it. Well, there's a reason for that. And the reason for that is something having to do with this. The International Monetary Fund warned China over the cost of COVID lockdowns, saying the hardline approach, as they call it, to the pandemic risks damaging the global economy. And so this is what we're really up against. No one really thinks that opening schools is safe. No one really thinks that pandemics don't spread in school, but they do know for a fact that when you close down schools, it keeps parents home from work, and that slows down the economy, and it keeps billionaires from making as many billions as they want to make. That is the whole policy question that we are really up against. But my third point is a basic one. Because policy has such an overwhelming effect on who lives and who dies, that means we are not at the mercy of this pandemic. Policy is something we can change, and we don't have to throw our hands in the air and just wonder, what is the virus going to do? No, the question is, what are we going to do? And you just look at what simple policies can do. Here's just a simple graphic showing what the chances are of a severe outcome for vaccinated people versus unvaccinated people. And it's overwhelming. A simple policy like mandatory vaccinations among vaccinated people over 50, 3.55 severe outcomes per 100,000 people. Among unvaccinated people over 50, 91.1 severe outcomes per 100,000. That is, many, many times the difference. When you add up the effect of all these policies, doing things like mandatory school closures, mandatory vaccinations, mandatory testing, mandatory masks, in particular high quality masks, the things that we have been demanding, add all of those up. And that is why in certain countries, you are hundreds of times more likely to die from COVID than in other countries. And that is a point that we in BAM have been making for a long time. And I just want to reiterate, this is the point that gives us actually great cause for optimism, because we are a civil rights and immigrant rights organization, and we have been fighting around policies for our entire existence, fighting for the right of people to live freely and equally in this society. And we know that when we fight, we can win. And so it's no accident that we, as the kind of organization we are taking up the struggle around COVID, because it is time for millions of people to learn the traditional civil rights methods of direct action, to really take our lives into our own hands. Otherwise, we are at the mercy of billionaires and policymakers who really just regard our lives as fodder. Our lives are cheap to them. Our lives are very expendable to them. But we know that when we come together as a movement, we're more powerful than they are. And we can make demands to which they must adhere. We can make the measuring stick for any school district. If you are serious about protecting human life, then you must also be serious about doing school closures and remote learning. You must also be serious about mandatory vaccines. You must also be serious about high quality masks and all of the other measures, testing, contact tracing, quarantine periods. We have to get rid of this nonsense that after only a few days of quarantine, you can go right back to school, back to work. That's ridiculous. But if we win the policies we need, we actually can change the severity of this pandemic. And what the data shows us is that we can change it hundreds of times over. We can change it dramatically. And so I salute everyone, in particular the students who have been doing walkouts and the teachers who have been leading strikes and sickouts. You are the real policymakers who are saving lives. And you are the people to whom this nation should look to as the real leaders, the real defenders of humankind. And it's a real honor to be speaking to such leaders today. And so I will hand things over to the chair and to Nicole.
Thank you so much, Neal. Neal, can you stop sharing, please?